everyone, welcome back to the Power to Perform podcast. I'm your host, Allie Mallory, and I am the mental performance consultant and case manager here at PHP. And I am here with two wonderful women that I will let them introduce themselves. Let's start with you, Dr. Van Bach.
Yeah, thanks for having me, Allie. My name's Karen Van Bach. I am one of the team physicians here at CU. I am a sports medicine physician and a family physician by background. I do a lot of different things, but in particular, love taking care of people in that intersection between regular medicine and sports medicine.
Amazing. And you do a wonderful job at it.
You are very kind.
We're very lucky to have you here at CU. All right, Emma, who are you?
I'm Emma Pollock. I'm a junior on the track and field team, and I'm a 400 and 400 hurdle sprinter.
It's truly amazing. I could never.
I could never do either of those things.
Yeah. I am always so impressed with track athletes because I always think about this. It's your sport is everyone else's punishment.
Mm-hmm. That is so true.
I heard that in high school and it's stuck with me because it's just so impressive. So thank you both for being here. I'm very excited. So today we're going to be talking, it's a little different than other episodes. We're really going to be focusing on psychotropic medication with student athletes, or how it works within athletics, which is why we have the wonderful Dr. Van Bach here, and then Emma, who will be sharing her vulnerability and her experiences through it all. So again, thank you both for being here. First question, Dr. Van Bach. What are some myths you've heard around psychotropic medication use?
Yeah, that's a really good question. And I'll tell you that most of the answers, most of kind of what I have to say about this really reflects what I talk to people about in the office. So I think especially when I talk to young people, one of the conversations we have the most often is around fears of how long people are going to need to be on this medication. I think a lot of people have this idea, because it's a daily medication, that if I start this is something that I'm going to have to be on forever. And I'm not going to be able to get off because it's going to change my physiology somehow. And actually, the vast majority of people that we use neurotransmitter modulators for mental health, for depression, anxiety, things like that, the vast majority of people are on it for a year to a few years. Yeah. That kind of matches with what we see for these conditions, where most people who have depression, most people who have generalized anxiety disorder will kind of go through a period where it's more active and then kind of go into remission, either for the rest of their lives or for an extended period. So I tell people that I'm not saying that doesn't mean you'll never have to be on the medication again, but it's definitely not something that we expect, especially if we're starting it at the age of 20, that someone's going to need to be on forever. And if that is the case, that someone is someone who uses these medications for in the more long term, it's not because of the medication. It's because that something about that own person's mental health physiology means that they benefit from being on this more long term.
Very well said. Thank you.
Great.
Great
That's the
job.
other thing. I was like, does that make sense?
Yeah.
Does that make sense?
No, because I think there that is a huge idea or ideology around medication. So that is helpful to kind of demyth that of nope, that's not actually true. You may not actually be on this the rest of your life. Did you ever hear about that, Emma? What was your...
I sure, before I started taking antidepressants and talked to Dr. Van Bach about it, I was one of those people that thought you're on it for forever or extended periods of time. I had no idea. It kind of varies from person to person. So that was definitely news to me. And also I kind of thought that it was one of those medications where if you miss even one dose, that you kind of go off the deep end in a sense, or kind of start to spiral. But I learned that is actually not the case, and it's not like a lot of other medications where if you miss a dose, it's super detrimental, and you don't have to take it the same exact time, just the same general time. I take it at night. I don't have to take it 10 p.m. every night. It can just be before I go to bed. And so those were a couple misconceptions that I had about it.
which is great because I feel like student athletes are so busy. So the fact that there is like some flexibility with medication use, I feel like could be really helpful. Okay, next question. So if a student athlete like tries medication and it doesn't work for them, what are the like common next steps?
Yeah, that is also a really great question. And I think there's kind of a lot to say around that. And I think where I'll start is by pointing out that, and you know this, I think this is something that you could potentially even comment on too. It's actually not very common that medication alone is the right treatment option for people.
Yep.
I actually think about this as mirroring my musculoskeletal practice pretty closely in that most of the time, if I'm putting someone on an anti-inflammatory or doing an injection for a joint or muscle injury, I'm also sending them to physical therapy. And so almost always neurotransmitter modulator psychotropic medication is best used in combination with mental health therapy. And in an ideal world, and I think this is something that's really nice about the interdisciplinary team that we have here in athletics, if we try a medication for someone and it's really not working, in an ideal world, we can kind of get together either all together or you and I can talk, and then you and I can talk as a team about what's going on there. Does it seem to really be that this isn't the right medication for someone, or is there also some more kind of acute life stressors that we should work on in therapy? So ideally, if we try a medication and it doesn't seem to be the right option, I can kind of use my partners, both the patient that I'm working with and the therapist that they're working with, to kind of try to troubleshoot that. So that's kind of half of the answer. The other half of the answer actually gets back to what Emma was talking about. You know, there's a pretty long list of kind of cousin medications in this kind of big umbrella. And we actually know that there's genuinely a genetic component to which medication works best for certain people. So I think this is another thing that people worry about. You know, if I try a medication and it doesn't work, it means that medication isn't going to work for me, or it means that there's something wrong with me, or it means that medication doesn't work at all. I was like tricked into trying these things. That's what I worry about. No one's ever actually said that to me. But there's actually physiologic truth to the fact that certain formulations just work better for certain people, and certain formulations work better for people who have different kind of nuances to their mental health condition. So really, if we give a medication a good try and it doesn't work, then we switch to a different one. Oftentimes in that case, we're kind of digging in a little bit more to someone's family history. You know, do they have someone in their family who has had depression, has had anxiety, who has had success with a medication? That can really help us in guiding what might work, what might not work. And then there's a lot of actually nice kind of decision tools that are available online to kind of looking through and comparing the different medications in terms of side effects. What would people experience if they missed a dose? How long of a taper do people need when they're going to come off? And really trying to kind of match things up to people's personal situation.
Yeah. Yeah, and even what you're talking about for that first part about working with the therapist, I know from our end, it's always, you know, we assess what are they coming in for, and then after a few sessions, it's like, oh, actually, they could really benefit from this medication, like you said, in collaboration with those mental health sessions. And then even just for the listeners too, knowing like we would never then just go to a doctor and start talking to them about our clients', you know, mental health concerns. It's definitely a big discussion with the client of like, hey, this is what I'm thinking. What are your thoughts? And if so, let's have you sign a release of information. So we always want to make sure that we're protecting our clients' confidentiality. But like you said, working on an interdisciplinary team.
It's a big word.
It's been a long day. Can be so helpful. And that's what I love about working in this setting is like we have so many people with their specialties. So it's like if we can all work together, that's how we can best serve the student athletes. So Emma, anything you want to comment?
Yeah, I totally agree. I think that made it way easier for me because I didn't necessarily know if antidepressants were the right route for me, but I knew that I was doing all the other steps to bettering my mental health. So when I came back to see you and met with my therapist, like that was one of the first things I mentioned was I'm interested in antidepressants, but I honestly know nothing about them except for a lot of the myths were all I was familiar with. And so she like walked me through how those misconceptions aren't necessarily true. And then she encouraged me to connect with Dr. Van Bach. And so then I went through the confidentiality steps and then met with her and talked to her with what my therapist had recommended. And then we really just talked about like actually understanding what the medication would do and the different genetic things that I had no idea about and how the medication actually works. And so then from that point on, once I started the medication, then it was when I would need a refill, then it was first talking to my therapist and discussing the past few months with her and what had improved or maybe what I'm still struggling with and if I think I could be doing better, and then kind of determining with her where we think maybe medication might play into and if we should up my dose. And then I would meet with Dr. Van Bach, discuss those same things, and then we would come to the decision on whether or not we need to up a dose or if I'm fine with where I'm at. So like that continuous cycle of being able to go to my therapist and Dr. Van Bach and them having connections and like having their own meetings is really helpful, that everyone's on the same page and knows what's going on, and it just makes it so much easier to like go through this like new process.
Absolutely. And Dr. Van Bach, can you kind of touch on too on what does the confidentiality look like from your side? So like if you're working with a student athlete, who else knows that they're coming to you about medication?
Yeah, that's a really good question. And I'll tell you kind of in general, if you were just one of my primary care patients, you were seeing me kind of in a regular outpatient practice. No one who's not a direct practice partner of mine in that setting would have access to Emma's medical records or any other patient. I wouldn't be able to just tell anyone, including family members, including coaches, including teammates, professors, random people on the street, but that includes a patient's therapist. So if I start seeing we start medication, I can only talk to their therapist if they've given me a release to talk to that person. Here in the athletic setting, the same principles are true. Because we have this really integrated interdisciplinary team, which includes athletic trainers who are doing day-to-day rehab, but also helping manage kind of day-to-day medical issues, because we have dietitians who are seeing patients clinically. When athletes come in here, a piece of their intake paperwork is basically signing a preliminary record release in terms of who has access to their medical information. But especially when it comes to kind of new things like mental health diagnoses, like other chronic medical problems, essentially if we're going to start a new medication that we want to really discuss with members of the interdisciplinary team, we essentially go through that process again. And so there's this whole layer of confidentiality that comes around my care, and then there's literally an extra layer that comes around specifically mental health care. So even though myself and the athletic trainers are kind of considered members of the same medical team, in order to have these conversations between medicine and mental health, we need a new kind of separate layer of release to that. So I hope that answers that aspect of the question. The other thing that I think is always a worry for me, and I imagine to be a worry for athletes, is what about teammates, coaches, things like that. And so the nice thing here is we use an electronic medical record that's the same one that we use in regular practice. And so even if they wanted to, regular teachers, staff members, academics, coaches couldn't get access to that even if they wanted to. There's like federal regulations that restrict who can and can't have access to that information. So, that's just kind of been a nice upgrade over the years as we've really kind of solidified the training room as a true medical office. Technology has given us a lot more protection that way.
That makes sense. Yeah, Emma, did you ever have that like concern, or even just like, oh, I wonder who does know that I'm on medication? Because I know you've been so open about it too, but what was that experience like for you?
Yeah, I did kind of wonder who would like know, but I've been very familiar with, like, especially PHP, with signing the release forms and checking off who gets to know and who doesn't get to know. And so I figured like that was the same thing through this. And I've been very open with that. Like, I've always wanted like my coaches to know about everything, and just like every member of, I don't know what you would call it.
Medical teams.
Yeah, medical team members. I always want everyone to be on the same page and know, because obviously that makes it a lot easier for me as well, that I don't have to worry about relaying information to people. Like, they can get it directly from the doctor or like my trainer or therapist. And so for me, I've always just checked that all the important people can see it, because that just makes it easier for me in the long run. And I'm okay with those people knowing. And so, but having those options is really nice to know, that I know exactly who's getting the information and who isn't.
Yeah.
And I think a lot of that is something that we really benefit from when it comes to transparency. So, you know, as a patient myself with my own physician, as student athletes here, those kind of things, it's just really important to be honest about what you do and don't feel comfortable with. And, you know, for example, the athletic trainers make the appointments on the team physician's schedule here. That's just kind of logistically how our system works. If someone's on a medication and they don't feel comfortable with their athletic trainer knowing about that, we can always just make that appointment as a generic follow-up, right? Like, we need that person's help for the logistical piece, but as long as everyone is aware, and as long as that individual is upfront with me about, you know, how much information they do or don't want me to share, even with other members of the medical team, there's always ways that we can kind of work around that. So
Yeah.
it's a spot where it's just really important, I think, too, for people to be able to advocate for themselves.
Absolutely. And I feel like it comes down to like that trust and relationship between a student athlete and the support staff, right? And it's like, ideally that's there, and that you would feel comfortable with them knowing, so that everyone is on the same page. And it's nice that there are systems in place where you can still keep that like confidentiality, even if they are the ones scheduling or whatever. So I feel like, yeah, it's a good system that has probably taken a few years to get all set up and perfected, but glad that we're finally there at CU. Okay, so kind of switching back to more of like the medication use. Dr. Van Bach, what are some common side effects to medication use, and how long does that typically last?
Yeah, this is something I always have to think about. To be honest, these medications tend to be very well tolerated. I don't have a lot of people, once we find a medication that's a good fit for them, who have trouble with side effects. They're not medications that are sedating, so they're not medications that should make people sleepy. And most of them are not particularly activating. So they also tend not to be medications that give people trouble sleeping, most. Okay. I do find it pretty common, especially in this age group, that it may take people from like a GI standpoint a week or so to get used to the new medication. I had a teacher at one point in my medical education point out that there's basically as many serotonin receptors in your GI system as there are in your brain. So it's very common for these medications that partly work on neurotransmitter receptors, that it can change people's GI, I guess, physiology a little bit. That tends to go away, usually within just a few days, but typically within a week or two. And at that point, if it doesn't, that would be a reason that we would think about a different option. In the long term, I would say, in a more kind of general practice sense, the most common reason that I need to switch someone off one of these medications is they actually can affect people's libido. That is not something that tends to go away the longer people are on it. So if we have someone and that's like a truly bothersome side effect, that would be a reason that we would switch. So those are kind of the more common things. I mean, I think you'll always find people who maybe get headaches with a new medication. That can happen with almost anything. Depending on someone's kind of particular flavor of kind of mental health symptoms, their psychology may feel a little kind of funny getting used to a new medication.
Right.
So in particular, some are better and some can be more triggering for anxiety. If people struggle with ADHD as well, that can kind of throw a nuance into picking a medication. So sometimes kind of the switching through medications and picking the right option has to do with someone's particular mental health symptoms. But yeah, those are kind of the most common things I would say. GI stuff in the short term, sexual side effects in the long term, which are not permanent. It's just like you
As
stop the
you're using
medication, it should
yeah.
go away.
Yeah. Well, that's good to know. A lot of this, besides the libido, that a lot of them don't last that long, because especially if I'm having GI problems, I'm probably going to be like, I want off this now. So it's good to know it's only going to last a few days.
Yeah, and we often, I think one of the advantages for me of practicing in this setting is I can see people really often. They don't have to pay a copay, right? So
yeah.
I often will see people even just a couple weeks after we start people on a really low dose, give them time to kind of get used to it. But that's kind of a luxury we have here.
It's definitely. Yeah. Emma, do you mind sharing what some of your common side effects were?
I will say I was very worried about side effects, because that was another thing I didn't know about, and I just kind of viewed antidepressants as like this major medication, and it was really like daunting to me, and I kind of just tied along with that, with there being like major side effects that would be like kind of steer me away from wanting to take it. But I quickly learned that actually side effects aren't that common with antidepressants, and so that was nice to know. But I did get like about a week of GI problems, and like I've struggled with GI a lot with workouts like the past year before starting taking antidepressants, so I was fairly worried about that. But it wasn't really anything major. It only lasted about a week. It's just like nausea and like some discomfort, so it really wasn't bad. And I have noticed that anytime we do increase my dosage for about like a few days after that increase, I do struggle with sleep for a few days. But now I'm just at the point where like I know that's going to happen, and so it's not really too bad. But those are the only real side effects I've ever had, is just like a little bit of sleep problems after a change, and then the GI in the very beginning, but that's it.
Nice. Thank you for sharing. I know I kind of put you on the spot there.
Of course.
And then another thing I was wondering is, how long does it typically take for medication to start working?
Yeah, so the medications that we tend to use for both depression, for generalized anxiety disorder, are SSRIs, which are selective serotonin reuptake inhibitors, or their newer cousins, which are SNRIs. And then there's a couple of other neurotransmitter modulators that work on a bit of a different kind of combination of things. This maybe is a bit of a myth, and I think I end up talking to people a lot about this. We don't really have a lot of options that are like a quick fix that you can just use kind of one time here and there. Part of that, I think, is understanding these mental health conditions and starting to understand this as more of a brain physiology issue than just I'm stressed out by kind of particular things that are happening, on a day-to-day basis. So if we really want to kind of level out that brain neurotransmitter biochemical physiology, what we need is something that is kind of an everyday, works all the time fix. But because this is actually working on like those chemical pathways in the brain, they're not medications that can be expected to work super, super quickly. Mm-hmm. And there's something that you take every day. For depression symptoms, we typically say people can expect it to take even 6 weeks to notice kind of the full effect of a dose. And then changing a dose, there's another kind of adjustment period. There's some evidence that for anxiety symptoms, people notice the effect a little bit faster, but it's still on the order of like 3-4 weeks at least. So that's another thing that we talk about is this is really an exercise in patience. And it can be difficult if people are really kind of in an acutely distressed situation. But yeah, I think the most important thing there is just setting expectations that the best way to treat this condition medication wise is with something that's actually going to give someone kind of like a continuous support for their brain physiology. But because of that, the side effect is that it takes a little bit longer.
Yeah. Well, and I think then it comes back to like the importance of the collaboration with like seeing a mental health therapist in the meantime, especially if it is going to take up to 6 weeks for some people. Emma, how long did it take for you until you started noticing changes?
It took me like a fairly long time. Like I started in August, and then I noticed like small changes in like my anxiety levels, but nothing really major until probably about October. Like October was where I really noticed a huge change, and it just kind of like felt like I was getting like closer to how I used to be before I kind of went through my depression. And I know it's not like sudden for everyone, but I just remember like telling my therapist like one day I like woke up and then it was just like completely different kind of, and I just like felt like so ready for the day, like excited to go to school and practice. And then that was like kind of like shocking to me because it was the first time I'd felt like that in probably like almost a year. And so that was really crazy for me. And then it was kind of like, oh, well, is this gonna last? And so then I was kind of worried about it going back to how it had been, but then it continued for like about a week to stay like that. And obviously there's ups and downs, but since like October, like it's been getting continually better. So it took about 2 months for me to really notice a difference. And then obviously like checking in and then like increasing doses to like get even better has helped a lot. And so I've noticed a huge change, like me now compared to like even October or especially August has been like a complete 180. Like it's crazy. And so just like taking it consistently and knowing that it takes time was really important, and that eventually it will get better and doesn't always happen suddenly for everyone. And so just keeping that in mind and knowing that it was something that was going to take time was really important.
Yeah. And could you talk a little bit about how it impacted your performance? Like once taking the medication, like did you notice any difference in track?
Definitely noticed like anxiety levels went down when just like coming to practice, because when I noticed like major changes, it was during off season, like just fall training. And so I wasn't competing at that point, but I was like looking forward to going to practice and knowing that a hard workout was coming up wasn't like weighing down on me as much, and I wasn't experiencing as much anxiety with handling those things. And like just being around teammates was a lot easier for me, just being able to be like social and be comfortable at practice was so much easier, and just like being able to bring like a better, more positive energy was so much easier than it had been in the past, because I was having more good days than bad days obviously now. And so that was huge for me, being able to like bring that kind of energy to practice.
Yeah, which makes total sense, right? Because at the end of the day, you're not a robot. And because you are human, and if your mental health is better, people's physical health tend to be better in their physical performance. And so it's all related, right? And so that's really cool that you're able to see that change in track as well.
Yeah.
Could you just talk a little bit about like overall, what has your experience been like on medication? Like I know you've touched on it throughout the episode, but just an overall explanation.
I feel like it's been very positive for me, and I can't really imagine where I would be without having started it, because it was the thing I went back and forth on all summer on whether or not it was something I needed to do. And ultimately I decided it wouldn't hurt to try it after hearing everything about it and understanding it more. And so I like can't imagine having not taken that step into trying it. And I think it's saved my life for sure. Like I don't know where I would be without it right now. And feeling the way I am now, like before I went through such like a hard time last year, I never thought that I would get back to like how I had been before, because I always saw myself as like optimistic and like very joyful and happy all the time. And then obviously those things happened and I was just a complete opposite. And I never expected myself to be able to get back to where I was before. But with antidepressants, like, it's definitely been like a huge help. And I think one of the main ways I've been able to get back to that, because I've already like been doing therapy and all those things. And so this was just like that extra boost and help that I needed. And it's been super helpful for me. And yeah, I just can't imagine where I would be without it. And I think my performance athletically would have definitely continued to suffer. And I think just also as a human being, I just would not have been able to get back to the place that I have been. And so,
yeah. Which is more important than the performance,
yes,
for sure.
For sure.
And thank you for sharing that, because that is so common for anyone who is dealing with depression, is like that feeling of like hopelessness of I'm never going to be how I was. And then we can really get down a very scary spiral. And so I'm so glad that you were able to get help and get on medication, and that it's been going so well for you. And kind of just to end this podcast of like the stigma around, mental health, medication, both of you, what have y'all noticed in terms like, is there a stigma, especially in athletics, around medication? And if so, what can we all do to like break it? Whoever wants to start.
Do you want to go first?
I have to think about that. There is a stigma. I mean, that's the answer. But then I have to think about how to explain. I think there's so much to that. I think part of the stigma is just recognizing that to some extent difficulties with mental health is something that we all deal with, and it legitimately can be very difficult to understand kind of what's normal, what's not normal. I think there's a lot of this that has to do with just the society that we're raised in, that we live in, when it comes to understanding that all emotions are healthy, and it's healthy for us to experience that. I think a lot of us didn't learn how to feel our feelings in a healthy way growing up, and it's hard to learn that when you're an adult. I think there's a lot in society in terms of just having unreasonable expectations in terms of how many things someone should be able to do in their life. What is success? What does it mean to be happy? I have a lot of thoughts about all of these things.
That could be a whole episode.
That could be a whole episode. But I think it can get really confusing, because being an 18-year-old, being a 20-year-old in an American college is really difficult in and of itself. And then being in an athletics environment is really rewarding and really difficult. And so understanding when this is just kind of regular life difficulty and when it's more than what it needs to be. And a lot of that comes into utilizing your support system and having a support system. And I think a lot of people come into this setting and they don't know how to utilize your and my services. Mm-hmm. And that part of what we're here for is just understanding, is this normal? Is it not normal? Does it have to be this way, or does it not have to be this way? So just starting to be able to ask those questions, I think is a big barrier. And because we run into a lot of people when we ask those questions who their preconditioned answer is, it's fine, it's normal, ignore it, don't worry about it, just don't worry about it. It can be hard to know who those safe people are to kind of talk to. So, I think for me, a lot of it is just understanding ourselves and understanding kind of how life does and doesn't have to be. And then the next thing is just, if you're not doing well, understanding that that's not because you've done something wrong.
Yeah.
And that it doesn't have to be that way. And there are different things that we can do, and treatment looks different for everybody. And again, we've talked about this. That's therapy, but there's different types of therapy. Different therapists are a good match for different people. Mm-hmm. Physicians are the same way. Medication is the same way. And I tend to think of this as, in all ways, mental health difficulties are a biochemical process. Therapy helps from a biochemical standpoint, and medication also helps from a biochemical standpoint. So just to normalize that none of this is someone's fault ever. And saying therapy is a good fit for someone isn't an attempt to delegitimize what they're experiencing. It's just like it's a proven treatment modality for that biochemical process in the same way that medication is. So that's the rambly answer of all the thoughts I have off the top of my head about that question.
No, thank you. That was very well
With
said.
no conclusion.
Oh, Emma, what about you?
Dr. Van Bach said it really well, and I totally agree that a huge thing is knowing, like, what is it supposed to be, and do I have to feel this way are huge things. And that's like something I struggled with a lot last year. Was in the middle of everything, I was like, is it half, like, I kind of felt like this was how it was supposed to be, and I didn't really realize that, like, it didn't have to be like that. Like, life didn't have to be that hard. I was kind of just like, oh, this is just like a rough time in my life. Like, this is just how life is. It's difficult sometimes, and that's just exactly what this is. But it definitely was not that, and it was way harder than it needed to be. And like, medication just seemed so daunting to me that it was like, is it like actually bad enough to have to be doing that? Like, maybe that this isn't like what that actually, like, that's not the actual answer for this. Like, I'm actually fine. Like, that's not the case. But talking to my therapist and Dr. Van Bach, it was like, no, like, this isn't how it has to be. And that was very comforting to me, that like, life doesn't have to be that hard, and there is a way out of everything, and like that kind of stuff. Like, there was a way out of that. And I think that understanding that things don't need to be that way has been a huge part of my journey. And like, even on antidepressants, like, I'll meet with my therapist, and when I'm about to get a refill, like, we'll talk about the last few months and review them. And even then, like, we'll realize that, okay, like, these things that I'm still feeling, it doesn't have to be that way. Like, that's still like not a normal thing to be going through and struggling with, even though my body is like, no, this is normal, like, it's fine, like, just push through. And it's like, no, like, these things aren't normal. And it definitely hasn't been like an easy road trying to come out of everything and getting better. And it took me a long time to like not struggle with things like me and my therapist talked about, like, for example, passive suicidal ideation. And last year it was more of like, this is kind of deep, but it was like, I want to kill myself. But then once I started taking antidepressants, then it was more of like the I should have killed myself, or like I wish I had. And so to me, like, when I was in that point, it was like, oh, well, it's not like active this time, so like it's kind of normal. But my therapist was like, no, like, we can increase your dosage, because like that's not how it should be. Like, I don't want you to be having those thoughts like this frequently. And so having like that continuous conversation of what I'm feeling and going through and thinking, and like just putting that out there to then get the validation of, no, like, that's not how you can do better than that. And so like having those conversations and truly understanding that there are things that your body will internalize and be like, no, this is normal, when it's not, has been a huge thing for me and is really important in understanding.
Yeah. Well, thank you so much for sharing that, because you are not alone at all in that struggle and having those experiences. And so I think just by you even sharing your story, like, just know like that has a huge impact on anyone listening. So seriously, thank you. And thank you, Dr. Van Bach, for sharing your knowledge and expertise. I honestly learned a lot in this episode. So thank you. And thank you, everybody, for listening.